Hi there, my name is June. Today I'm going to show you a demonstration of administering insulin using an insulin pen to our patient Jessie. So I'm going to start off in my med room, and as you've seen in all of the other videos, this is where we do our medication preparation. So I'm going to start by doing some hand hygiene. So the first parts of safe medication preparation are, of course, arriving in our usual scene. It's first thing in the morning. The doctor has come in while we're away. He's written an order for Jessie, perhaps, and when we arrive on shift, it's time for us to become accountable, responsible for the orders that we see written for us. So I arrive on shift and I discover a doctor's order written for Basaglar. So we're going to talk a little bit about the different styles of pens, or the different types of pens, in a minute. But the doctor has ordered Basaglar quick pen, 10 units before meals, subcutaneous each day. And so the first thing I'm doing here is checking that I have all of the components in the doctor's order that make it complete and accurate. I have a drug name. Actually, if I start from the top, I have my patient name and I have my patient's health card, and I have a date of birth. You need at least 2 identifiers. I see that my patient has no allergies, and then as I move down and start to go through that order, I see that I have a drug, the Basaglar quick pen. I have a dose, 10 units. I have a route subcutaneously. I have a frequency before meals each day. I have a doctor's signature, and I have a current date and time. So all the components are there that make it complete and accurate. So now, if it wasn't already transcribed to the MAR, or the medication administration record, I could go ahead and proceed now. Everything is safe here for me to transcribe. And so as I look at my MAR, my medication administration record, it is already transcribed for me. The night staff were kind enough to do that for me, and so it's all transcribed. And I'm just going to go through those checks and see again one more time that I have the right patient, Jessie Moore. I have the date of birth, April 2nd, 1998. Again, I see no known allergies. I have the drug Basaglar quick pen, 10 units, and that's exactly what's written on the doctor's order. I have a route sub-Q. I have a frequency each day before meals. I have a doctor's signature, which is there, and then I can see that 2 nurses have checked this MAR, and they've both initialed the medication box, and they both signed their master signature on the MAR. So this can get hole punched and put in the patient's chart. I don't need to look at that anymore. I can work from my MAR, my working document. And so as I start to look at my MAR, and I know I'm going to be giving this medication, there's some safety checks and rights that I want to start applying right away to this injection before I ever give it to my patient. And so I'm going to start by taking a look at the Davis Drug Guide, and I'm going to look up the pen that we're going to be using today is called a Basaglar quick pen. And so I want to find out the onset, peak, and duration of this drug. How fast does it work? I want to be checking the time and making sure that I'm delivering this dose before the meal is coming, but knowing when the meal is coming. I'm going to be thinking about all of the different assessment aspects that I'm going to be checking with my patient when I go in to see him in a minute, but before I prepare the med. I want to know if Jessie is vomiting or is on any steroids, so I'm going to be looking at the patient's chart on top of that. I want to find out everything there is to know about my patient. Is this new? Has he been newly diagnosed with diabetes? Or is he just needing some help because he's not feeling well? I need to know all of those things. That's the right education. I'm starting to apply the rights as I'm assessing this whole thing, and I'm also thinking about what type of assessments I'm going to have to do when I go see Jessie. And so that most important assessment is going to be testing Jessie's blood glucose to find out if his levels are safe in his body for me to inject insulin in, and that I'm not going to cause my patient any harm. And I cannot impress upon you enough the importance of checking your patient's blood glucose levels before you ever inject insulin into them. And no matter what anybody tells you, that is a standard that you must adhere to. You have to check your patient's blood glucose and find out if they're within the safe zones to inject. So I'm doing all those things, and so I think I'm fairly well informed about the drug and the onset and all of the things I need to know. I'm ready to go and do my initial visit with my patient, and so I'm going to leave my med room and I'm going to go to my patient's room. And when I come to my patient's room, I'm going to do hand hygiene before I, in front of my patient, and I'm going to introduce myself and say, "Hi Jesse, my name is June. I'm going to be your nurse today. Can you please tell me your full name and your date of birth?" And he's going to tell me, his name is Jesse Moore, and I'm going to double check it on that wristband and make sure I have the right patient. That is so important. And then I'm going to have a little discussion with Jesse and a quick assessment of how my patient is feeling. And I'm going to explain what the doctor has ordered and ask if they know anything about that. Have they ever had any injections before like this? How long have they been a diabetic? Do they have any questions or concerns? So I'm giving Jesse the right education. And then when I'm done, I've answered all those questions, and I say, "Is that okay, Jesse?" And he says, "Yes, that's fine. You can go and prepare that injection." Then I've given Jesse the right to refuse. He can have that right again when I come back with the prepared medication. But for now, I'm good with the right education. I know the right reason. I know that Jesse is a diabetic. He's been diagnosed. I've looked through the chart and the blood work and all of those things and the doctor's notes and diagnosis. And so now, before I leave the room, the most important thing I'm going to do is I'm going to swab a finger and I'm going to test my patient's blood glucose and make sure that my patient is well within the safe zones to inject. And you can find a more thorough understanding of those numbers in your Perry and Potter 2020 Canadian edition. So I'm happy with that, and Jesse's blood glucose levels are okay. I'm going to head back to my med station, and I'm going to start to prepare my drug, and I'm going to document. I like to come back and document my blood glucose level findings right away. They go in my little sheets for the day, my little notes, and they also go in the patient's chart and any other log books that are required by your agency. So very important to log that number. Sometimes your MAR sheet will even have a place for you to do that. So now I'm ready to start preparing my medication, and we're going to be using a safety engineered needle for our insulin pen. And so these are made by BD, and so on the little outside part you have a little tab that tells you quite a lot of information. It tells you that it is a 30 gauge needle, so when we talk about all the different needle gauges, you can see how tiny that is going to be, and it's 3/16 of an inch, so it's really short. It's a really short subcutaneous needle. There's a lot of other little pieces of information that are on this thing, and the camera is going to zoom in on this because that's important for you to understand about what you're doing here. We are attaching that needle, safety engineered needle, to this quick pen. So the cartridge of insulin is inside here, and there's my little end that I'm going to swab in a second. And this little end tells me a whole bunch of stuff. It tells me that, first of all, that sterile with an R means that it has been sterilized using irradiation. So we know that everything under there is sterile. Only sterile can touch sterile. So we're going to be swabbing that in to make sure we're not introducing bacteria. It has a lot and an expiry date. It tells you with that little symbol right there with the circle with the little 2 that it is not for anything except single use. So we only use this one time. Because it's safety engineered, it is you're only able to use it one time as well. So this is a really great addition and new technology for our insulin pens because now they're safe for nurses to use in all institutions. So I'm going to just set that down for a second. And now we're going to start talking about the preparation part of our needle, and the camera will come in and out as we're moving through this demonstration so that you get a really great view of how this safety engineered end works. So as I begin my preparation, I'm going to start my first med check. So my first contact with that drug, as usual guys, requires me to apply those 10 rights and check that med. And I start right at the top of my 10 rights with right patient. I know I have the right patient. I just went and talked to him. I checked his armband, and it is the right patient. I know the right reason. I know that he's a diabetic, and I've done the right assessment. I checked his blood glucose to make sure it was within safe levels. I know that I have the right drug right now because I'm looking at the pen, and it says Basaglar Quick Pen. This is just one example of an insulin pen. It says Basaglar Quick Pen on my MAR. okay? I don't have the right dose yet, but I'm going to in a minute. I know it's the right time because I've set this up. This is newly initiated, so it's going to be before every meal, and it's right before lunchtime for us. And so I know that that's the right time. And the frequency is before every meal, and the route is subcutaneous. We're talking about that. And documentation and evaluation are ongoing. So I documented a little bit when I collected that blood glucose level, for example. And evaluation is ongoing. I'm always going to be checking on my patient after I inject them with insulin to make sure they're not having any troubles. So that's my first check. So now let's start to get into the preparation, which is going to involve our second check. So I have this little end. The cartridge of insulin is inside here. You can see the little like a spring mechanism that is pushing the cartridge to the end. So you can see how much, right where that gray stopper is, that's how much insulin I have in there. So I'm going to start by taking an alcohol swab, and I'm going to swab that end really well. So I'm making sure that I'm not introducing any type of bacteria, a good 10 to 15 second scrub. Okay. And then I'm going to, and I'll do this a couple of times so you all get a really great look at this. So I'm going to peel off my label. You can see part of that needle is sticking out, and I'm going to screw that in. So it just pushes into that hole, and then I'm going to screw that on. This is just the white cover, just till it's snug. And then I'm going to take that cover off. And so it's important for you guys to identify that this white sleeve is housing part of the needle. You can see the needle sticking out just past the white sleeve in that little clear part. See the needle sticking out there? It's really tiny. Well, when we depress this part to the skin, we have to push this clear part right into the white sleeve. And I'm going to show you what that looks like in a second. And so next I'm going to start preparing. Well, this is a needle tip as well. We never inject air into our patient, so we're going to prime this needle. So we're going to start by drawing up 2 units. You need 2 units, and just turn that little dial. There's 2 units. And then I'm going to depress that end, and you're going to see a couple of drops spray up. And if you don't see a couple of drops spray up, then you're going to do it again. You need to see the insulin come out of there. If you try a couple of times and you don't get anything to come out of there, out of the end of the needle, you'll need to take that needle off and put a new one on and do that again. So I'm in preparation. I've primed my needle. I'm going to do my second check. And again, I'm going to start right from the top, and I know I have the right patient, and I know it's the right drug, and it's the right, getting ready to make the right dose. It's the right time. It's the right route. My MAR tells me it's sub-Q. So all those things, I'm applying all those rights. I know the right reason. I've given Jesse the right education. He had the right to refuse. And documentation and evaluation are going to happen at the end and ongoing. I'm always evaluating. So that's my second safe med check, and I'm going to do one more as I finish to draw up. So my order says that I need 10 units. So now that I've primed my needle, it's back at 0 again. I'm going to draw up my 10 units. So you can see here the camera's going to come in again. I'm just turning this to 10 units. Okay. When we hold our pen, we hold it in our palm. We hold it so that we can activate the thumb, but we don't hold our thumb there until we're actually ready to inject. And we puncture the skin in this method. And we're going to push all the way down, and we're going to hold that push. BD recommends that there is no need to pinch the skin when we're injecting a sub-Q needle this small into regular people. So unless you have a really tiny baby or somebody who's very, very tiny, it is not recommended that you pinch the skin as you normally do in a subcutaneous injection. Okay? I'm going to show you this a couple of times so that you can really see the action of this safety engineered needle. So now I'm going to do my third check. And I'm going to start right from the top again. I know I have the right patient. I know that I have the right reason, and I've done the right assessment by checking my blood glucose and talking to Jesse. I've given the right education to Jesse, and he had the right to refuse, and he can refuse again when I come back. I know that I have the right drug. I'm really making contact and being present with my drug and my MAR. I know that I have a Basaglar quick pen, so I have the right drug. And now it says that I need 10 units. I have 10 units. Okay, and you can have a second nurse check that. You should always, if you can, have somebody else check your work. So I have the right dose, it's the right route, it's sub-Q, it's the right time, it's right before lunch. We've checked the blood glucose, we know it's safe to give it to Jesse. I'll document after I inject this into Jesse, and then I will continue to evaluate my patient and make sure Jesse is safe throughout the day. So I'm going to do this a couple of times so that you get a really good look at what this looks like. I'm going to do it from the bedside, and then I'll come back to the med room, and I'll just go through that one more time. So I can't put the cover back on there, but that needle is safe in there. I am safe now to gather my MAR and my pen, and I have the rest of my supplies in my patient's room. So I am safe now to go to my patient's room with my medication. I know that I have the right drug and the right dose, and I'm just going to do that next check to make sure I have the right patient. So as I enter my patient's room, I'm going to set my stuff down on a clean surface. That's very important. And I'm going to do hand hygiene in front of my patient. You absolutely have to take this opportunity again to introduce yourself and say, hi, my name is June and I'm back. Reorient your patient and make sure that they understand that you're back again, and say, can you please tell me your full name and your date of birth? And they're going to say Jessie Moore, and you're going to check that on your MAR. That's your last chance to make sure that you have the right patient, because you know you have the right medication. So my MAR says Jessie Moore, and so does my name tag, and so does my patient, and I have the date of birth of April 2nd, 1998. So I know I have the right patient. And so now I'm going to move on to the injection part. Everything else is good, and I can ask Jesse, is this still okay for me to give to you? And he'll give me consent, and then I can go ahead and put on my gloves. We always perform hand hygiene before we apply our gloves, and then after we remove them. So I'm going to put on my gloves. I would have determined the site that I was going to give Jesse the injection, whether it was going to be in the deltoid or in the abdomen, and mostly I let the patient choose that. Today we're going to simulate an abdominal injection, and so I'm going to go ahead and swab my site, and the camera's going to come in nice and close here so that you can see me use that pen and hold my position with the needle as I go. So I'm going to swab a nice 5 centimeter area. Again, BD says that I do not have to pinch. I do not have to pinch unless my patient is extremely small and has no adipose tissue, and there's a risk that I might inject this into muscle. Okay? So I don't need to pinch. I'm going to hold my pen so that my 4 fingers are up near the top so that my thumb can get to the top button to inject. I'm checking my dose again. I see I have my 10 units. And so now this part is the really business end of this. So I'm going to push it to the skin all the way and hold this position. You see that set down? And we push the clear part right into the white sleeve. And so now I'm going to inject my 10 units. I'm holding my thumb. I'm going to wait 10 seconds. And I'm going to release. So I want you to now take a very close look at the end of this. The needle has been pulled inside of that safety engineered lock, and you can see the red ring. Okay? And so now if I pushed against this, it won't move. It's safe inside of there. Okay? I'd swab my injection site. We don't massage, we just hold gentle pressure. And then I'm going to remove my gloves, and I'm going to perform hand hygiene. And and I'm going to return my patient to a comfortable position. So in this case, we're going to just make sure our patient is all covered up. We would have provided lots of dignity and privacy for our patient by closing the curtains or the door, whatever we needed to do before we did any of the skill. And then I'm going to sign my MAR, and date and time are going to intersect, and I'm going to put my initials there. I'm going to talk to my patient. I'm going to lower Jesse to the lowest possible position, give him the call bell, make sure he has everything that he needs to be comfortable, and I'm going to tell him if he feels funny or anything that he might feel, sweating or trembling or any signs of hypoglycemia, to call me right away. I'll come in and we'll take care of him. And I'm also going to come back and check on him every few minutes throughout my shift, and especially after giving him that medication and making sure that breakfast is coming or sitting right in front of him and ready for him to go ahead and have. And so I'm just going to bring this all right back to the med room again. And I'm just going to, I have my injectee pad here, I'm just going to show you removing this. So the camera's going to come in, and you can see how it ejects there, so you can't access that needle at all. Remember how when we opened it up there was a needle there? So it's safe there, and I can't stick myself here. It's safe there. Still, these automatically and always go into the sharps container. They don't go in garbage. So I'm going to just swab this, and I'm going to just put another one on so you get another look at that. So we just peel that back. You can see the little needle inside. I'm going to just push that on and just screw that on. And then I'm going to take that cover off. And I would apply my gloves, but just for demonstration purposes, I just want to show you this again. BD recommends we do not have to pinch. So I'm just going to hold my pen against my palm. My thumb is ready to move to the thumb part and inject, but it's not there. I'm going to prime my needle with 2 units, and I'm going to make sure it can see that. And then I'm going to draw up. I'll just draw up 6 units. Okay, and I'm ready. I'm going to bury that clear part. So I'm going to not pinch, I'm just going to depress and hold. My thumb is going to then come up and inject. Hold for 10 seconds. Don't let the needle move. And then I'm going to pull it up and swab. You can see how that's safe in there. Okay. And that concludes our demonstration of using a quick pen or an insulin pen for our patients. Thank you.